Arthrodesis, anterior transoral or extraoral technique, clivus CLC2, atlas axis, with or without excision of odontoid process. Skull-tongue traction is applied. Avoiding the esophagus, pharynx, or esophageal nerve, the physician may incise the back of the throat, but most often enters from the outside of the neck, left of the throat to reach the C1-C2, atlas axis, vertebrae. Retractors separate the intervertebral muscles. A drill is inserted in the affected vertebrae in the location confirmed by X-ray. The physician incises a trough in the front of the vertebrae with a drill or saw. The physician cleans out the intervertebral disc spaces with a rongeur and removes the cartilaginous plates above and below the vertebrae to be fused. The odontoid process, dens, the tooth-like projection located on the second cervical vertebra in the neck, may be excised. The physician obtains and packs separately reportable grafts of iliac or other donor bone into the spaces and trims them. Traction is gradually decreased to maintain the graft in its bed. The fascia is sutured.
Arthrodesis, anterior interbody, including disc space preparation, discectomy, osteophytectomy, and decompression of spinal cord and or nerve roots, cervical below C2. Cervical below C2, each additional interspace. The physician performs spinal fusion, arthrodesis, for indications such as herniated disc, degenerative, traumatic, and or congenital lesions, or to stabilize fractures or dislocations of the spine. Skull-tongue traction is applied. The physician uses an anterior approach to reach the damaged vertebrae. An incision is made through the neck, avoiding the esophagus, trachea, and thyroid. Retractors separate the intervertebral muscles. The physician cleans out the intervertebral disc space with a rongeur, removing the cartilaginous material above and below the vertebra to be fused. Preparation includes discectomy and osteophytectomy for nerve root or spinal cord decompression. The physician obtains and packs separately reportable graft material of iliac or other donor bone into the spaces. Traction is gradually decreased to maintain the graft in its bed. The fascia is sutured. A drain is placed and the incision is sutured. Arthrodesis, presacral interbody technique, including disc space preparation, discectomy, with posterior instrumentation, with image guidance, includes bone graft when performed, L5S1 interspace. A fusion involving the L5S1 interspace is performed. This procedure is sometimes referred to as the transsacral interbody fusion, axial lumbar interbody fusion, or axia LIF. A small incision is made near the patient's sacrum. Under imaging guidance, a tube is placed into the L5S1 disc space. Using suction, the disc is removed. An implant or cage is inserted into the disc space and filled with bone growth material, bone graft, to restore the intravertebral space. Using additional incisions, pedicle screws are placed in the L5 and S1 vertebrae. Rods are connected to these screws. All surgical instruments are removed and the incisions are closed.